Hey, this is Dr. Taylor Krick at the Washington Wellness Center, and I want to talk about blood sugar for a second. Now, I talk about blood sugar a lot, but it's usually more on the diabetic side of things where, like, if this is your normal blood sugar range and you want to be here, diabetic might be up here, right? High blood sugar, chronically high blood sugar. But what we see probably more often in our practice, I wish we saw more high blood sugar, it's easier to correct, but what we see is a lot of young, thin women that have typically women, it can be either, but that have blood sugar spikes and crashes and have low blood sugar, more hypoglycemic or reactive hypoglycemia. And these are the people that have to eat 6 small meals a day. These are the people who everybody in their family knows that if they haven't eaten, they're going to get hangry. These are the people like the Snickers commercials that turn into a different person if they haven't eaten, and their blood sugar tanks. Now, there's a lot of problems with that. First off, low blood sugar is an equal risk factor for diabetes and insulin resistance as high blood sugar. So it's certainly a sign of insulin resistance. But what happens is when the blood sugar tanks, your adrenal glands kick in to compensate for that. So somebody that's constantly going through blood sugar spikes and crashes is constantly activating their adrenal glands. And they might not be under a lot of stress mentally, might have a pretty good life, whatever, or like handle it pretty well. But inside, their body's going through a stress response all the time. And then their adrenals become, fatigued or whatever, but they begin to have what's called HPA axis dysfunction that's secondary to their blood sugar problems. It also leads to hormone fluctuations and problems. Insulin resistance is the root cause of PCOS, polycystic ovarian syndrome, which is the #1 cause of infertility in our country, which is epidemic right now. So having well-controlled blood sugar. The other thing with this that's really tough is it can be really hard with a blood sugar meter. We'll teach people how to use their blood sugar meter, but if you check it in the morning and it's 90, and you check it in the afternoon and it's 85, you're not measuring these spikes and crashes, but they're happening. As soon as the crash happens, your body compensates to raise that blood sugar up. So there are some more advanced tests that we do, like a glycomark and some different things that can give us an idea of this, or an insulin resistance score. But it is something that is a concern. Like I said, we don't typically see it with like the typical diabetic phenotype, which might be more overweight, with high blood pressure, high blood sugar, more metabolic syndrome. We see it more with thin, underweight, often coincides with adrenal issues and energy issues or an afternoon slump, often coincides with like a lot of endurance exercise, and often tends to coincide with like a lot of bloating and different issues with that. But really it's about the blood sugar control and these spikes and crashes and how that tanks the adrenal system.